Attachment and attachment disorders. This is Dr. Claire Coles, and I direct the Center for Maternal Substance Abuse and Child Development, which is part of the Department of Psychiatry and Behavioral Sciences at Emory University School of Medicine. I'd like to acknowledge the many people who support the Center for MSACD. These include the State of Georgia Department of Behavioral Health and Developmental Disabilities, Health Resources and Service Administration of the federal government, Organization of Teratology Information Specialists, OTIS, which supports our mother-to-baby service, the National Institute on Alcoholism and Alcohol Abuse, the National Institute on Drug Abuse, the Centers for Disease Control and Prevention, and the SKK Foundation. I would like to note that I have no conflicts of interest to report. What do we mean by attachment? John Bowlby, MD, was a psychoanalyst, and he developed an evolutionary theory of attachment that suggested that children come into the world biologically pre-programmed to form attachments, and that they do so because it will improve their odds of survival. Currently, the main points of attachment theory are these. The child is believed to have an innate need to attach to one or more figures, usually the mother, during the first several years of life. To allow appropriate development, the child should receive continuous, good enough care from a caregiver over these first 2 years of life, and this is what's called a critical period theory. They also believe the maternal deprivation, which is separation from the mother or loss of the mother, leads to a failure to develop attachments. According to Bowlby, some of the consequences of maternal deprivation are as follows: delinquency, reduced intelligence, increased aggression, depression, affectionless psychopathology. There are also some characteristics that are thought of as the short-term effects of separation from an attachment figure. The child may go through a series of behaviors. Initially, they will protest, crying and clinging as they're taken away from their caregiver. Following that, they may drift into a period of despair when they stop crying, refuse comfort by others, and withdraw into themselves. And finally, they may reach a stage of detachment in which they recognize that the attachment figure may be lost. They will then engage with others, and if the parent returns, they may become angry with them. One of the important aspects of understanding attachment is the idea of the internal working model. And this is a cognitive framework that develops during the first several years of life that allows the child to understand his social world, himself and others. The interaction with others going forward may be guided by memories and expectations that were part of this internal working model. To talk a little bit more about the internal working model, it's important to understand the infant's behavior with the caregiver and with others are guided by this model. It is developed in the first year of life in the context of the caregiving experience and reflects the child's understanding of the world as presented to them by their attachment relationship. It will include expectations about how the child and others will feel and behave. It leads to a selective attention to certain incoming social information and to what would be the most salient social cues that reinforces the child's understanding of the world. It reflects feelings that are elicited during these kinds of intimate social relationships, and often causes one to interpret one's feelings through the lens of this internal working model. And as such, it becomes often a self-fulfilling prophecy, because often we see what we expect to see, and we interpret what we see through our expectations. Now, a number of people have evaluated attachment theory to determine whether this is a really accurate way of portraying the world. Early on, Bowlby said that there was only one possible attachment figure, and that was the mother, and she was central and necessary. And the implication was that a child could not be cared for by a surrogate or placed in daycare. In fact, when we study this, we find that this having one maternal figure and no others is a rare situation. Most children are cared for by many adults, and there's no evidence that such a situation is negative for the child. Michael Rudder also studied what he called privation versus deprivation. Privation, he believed, was a failure to develop this emotional bond originally. And all evidence suggests that this is the most significant issue. Deprivation is the loss of or damage to an attachment relationship. It is very distressing to the child, but if appropriate caregiving occurs afterwards, the effects of this deprivation can be reduced. In contrast, the privation condition, in which there was no development originally, is a more significant problem. How does attachment develop in this good enough environment? What do they mean by good enough environment? It means that none of us is perfect, and that most environments that are provided to most children are good enough, not very bad, and not perfect. Within this good enough environment, there's a biological need to attach. Infant animals have characteristics that make them attractive to other members of their species, and newborn infants are wired to respond to familiar adults, responding to visual, auditory, and olfactory stimuli. However, it's also a social environmental process. Parents or caregivers provide the feedback and the support that infants need. How does attachment develop? Attachments develop across an extraordinarily wide range of environments, and it is only in the extremely unusual circumstances that a child will have been reared in a way that prevents some kind of attachment from forming. In the first 3 years, the child requires actual interactions with caregivers in order to become attached to them. This specific need has implications for custody and visitation decisions. Later in life, children can sustain attachment relationships over much time and distance. There is what we call an attachment timetable. At birth, infants are able to distinguish women's voices from male voices, and they can pick out their mother's voice and smell from other women. By 4 weeks, children can distinguish social stimuli from other stimuli. At 2 months, children begin to prefer people to objects, and they develop what's called the social smile. At 3 to 6 months, children begin to express preferences for people. By 7 or 8 months, children may develop what's called stranger anxiety, but they clearly know their caregiver and familiar people are different from strangers. By 12 to 18 months, children begin to develop what's called separation anxiety. They can express distress on leaving their caregiver, and they develop the habit of checking in with their caregiver when they're in a strange place. By 18 to 36 months, children will actively seek proximity and contact with their caregiver or with the attachment figure. The attachment figure is thought of as a safe haven and a secure base, and this secure base is an important idea in understanding attachment. What is the purpose of attachment? It allows the child to survive physically. It is central to species survival that there be a caregiving figure who allows the child to survive over the first several years. In addition, we know that attachment is central to the development of state regulation or self-regulation. It also supports emotional development and healthy understanding and development of emotional connections with others, both during this early period and later. And it is also central to social development of the child. Much of this is related to the attachment figure being a secure base for the child. And the secure base can be best described by a quote, "Whenever I reached for you, you were always there." Now, in truth, the parent was not always there, but the child has developed the belief that the attachment figure is always there. There has been a good deal of research on the way in which attachment works and develops. One way it's measured is through the strange situation paradigm developed by Mary Ainsworth, and this is typically done at 12 months. The child and the attachment figure, usually the mother, are brought to the laboratory and are placed in a room with toys and other items where they can feel comfortable. Shortly after they've been there a little while, a stranger enters the room. The reaction of the child is observed, and then shortly thereafter, the attachment figure leaves the room, leaving the child with the stranger. Again, the child's behavior with the stranger is observed, and shortly thereafter, the attachment figure returns, and the way in which the child responds to the attachment figure is also observed. By doing so, researchers have identified 4 different kinds of attachment relationships. The most common is secure, and in this case, the child typically goes to the caregiver after they return and seeks comfort from them after being left with a stranger. Another kind is avoidant, in which the caregiver is ignored after they return to the room. Another is resistant, in which the child cries and resists comforting by the caregiver. And finally, there is what's called disorganized and disoriented attachment, in which the child exhibits conflicted behavior and confusion in how to react and respond. These insecure, avoidant, and disorganized attachment occur when caregiving environment has not been good enough, and there have been factors that have prevented a secure attachment from developing. Insecure attachment is often associated with anxiety, clinginess, heightened wariness. In disorganized attachment, the child exhibits various aberrant behaviors and mixed strategies involving incoherent combinations of secure, avoidant, and resistant attachment behaviors. Disorganized attachment is the most predictive of both current and subsequent psychopathology. Such children are at an increased risk for anxiety disorders, disruptive behavior disorders, dissociative disorders, later substance abuse, delinquency, and personality disorders. Attachment disorders occur in the context of caregiving dysfunction in the first few years of life. This may result from neglect and abuse on the part of the caregiver toward the child. It can result from maternal psychopathology or substance abuse where the mother is not able to provide adequate parenting. It might result from parental death and loss. It can result from environmental chaos, migration, war, separation from the parent due to disasters, and it can result from institutionalization of the infant. It does not result from trauma per se, or from separation from a parent or mother, caregiver, who has been adequate if this occurs after infancy. Because a child who has had adequate parenting may be deeply distressed by a trauma or separation, but they still have the capacity for attachment. The Diagnostic and Statistical Manual, used in the United States, defines two types of attachment disorders. One is reactive attachment disorder, and this is characterized by a consistent pattern of inhibited, emotionally withdrawn behavior toward the adult caregivers, as well as persistent social and emotional disturbance. And this occurs in children who have experienced extreme insufficient care. The second kind is called disinhibited social engagement disorder, and is characterized by children who behave in an overly familiar way with unfamiliar adults, do not check back in unfamiliar settings when they encounter strangers. It is not due to impulsiveness, and again, this occurs in children who have experienced extremes of insufficient care. Another person who has thought extensively about attachment is Charles Zena. And in a book written in 2009, he defined disorders of attachment in terms of the relationship with the caregiver, which seems a most appropriate way to talk about it. They are specific to relationships, and he says that this means that they are not within the child, but within the relationship. So there is an attachment, but the attachment relationship is seriously disturbed. And he defines three different types. Secure, and he calls them secure-based disturbances. The first type is self-endangering. The second is vigilant or hyper-compliant. And the third is role reversal. Self-endangering disorder is characterized by a child who leaves safety and wanders off all the time, who will place themselves in physical harm, and they behave recklessly, and they're often accident prone, and they may have a driven quality to their social behavior. They are also what we call socially promiscuous, in that they will go to strangers, they ask people to take them home, they don't seem to show any concern, no kind of social stranger anxiety. They do not have ADHD. There's another type that is vigilant and hyper-compliant. You will take this child into a room and they will refuse to touch toys even when they are offered them. They will withdraw. They may avoid social contact with most people. They have very restrictive affect or emotionality. They are hypervigilant, as though they're fearful. They may be excessively clingy and almost compulsively compliant with the caregiver's requests. I believe this may occur often in children who are abused. A final type is the role reversal type, in which the child exhibits what's called parentified behavior. They need to seem to be in control of their parent. The child may stay close to the caregiver in strange situations. They are over-solicitous of the parent. They're bossy. They will nurture the parent. They will try to control their caregiver. And they scrutinize the caregiver's well-being very carefully. And this is the child who is afraid of losing the parent. I also want to bring your attention to a paper that was written in 2016. And this was written by Brian Allen, who says, because of what he was observing here in the United States, that he would like to eliminate the idea of attachment disorder and attachment therapy. He did not feel that the diagnosis of RAD was a valid one, that this should, and that particularly this was the case because of the way in which it was being used to describe all kinds of negative behavior in children, particularly children who had gone into foster care, and that we should also view attachment therapy with great skepticism. He felt that the focus should be on the child's environment as the area of disorder, not the child. That the behavior the child was exhibiting is the result of the environment or the adults behaving badly rather than the child. and that any treatment applied in this kind of situation should be evidence-based only. I also list here some further readings which you might want to look at in order to understand the theory behind attachment more fully. Mary Ainsworth has written a number of good books on articles on this. Patterns of Attachment is a particularly good one. Bowlby's early work on attachment. There's a book called Becoming Attached, First Relationships and How They Shape Our Capacity to Love, which is for the layperson. And then there are also a number of articles. There's Charlie Zena's book on attachment disorders, and then an article by Spencer et al. On attachment and physical intimate violence later in life.